Aloha! Welcome to 808DeafNews. In today's news, I will be explaining about monkeypox. Monkeypox has spread nationwide on the mainland. There is a possibility it could spread here to Hawaii. The State Department of Health here in Hawaii is now investigating one probable case. Part of the research is figuring out how the virus is transmitted. Also, is it serious and dangerous? This report will include a list of questions and answers. The first question asked to officials, what exactly is monkeypox? It is a virus, a disease, that results in flu-like symptoms and skin lesions. It is from the orthopox virus family, which includes smallpox and cowpox. According to the CDC, monkeypox first showed up about 5-6 years ago. That was the first human case in Africa. Since then, cases have shown up in different areas of the world through traveling or by infected animals. Now, this virus has spread through the mainland, but the risk of infection remains low. The virus doesn't spread easily from person to person. The next question: what is the timeline of symptoms for monkeypox? Joe Helms, the epidemiological specialist for the State Department of Health, in a virtual press conference this past Friday with Kimball, explains it will vary from person to person. Once they are affected, how their body will react. They do, however, paint a picture and give us an idea of what kinds of symptoms will be. Upon onset and early stage of the disease, one can experience swollen lymph nodes, headaches, body aches, and fever. Then later, the virus will show up on your skin, rash on your hands, feet, chest, face, and genitals. Lesions and sores will show up later as well. This disease can last between 2 to 4 weeks, based on CDC's research. If you have a rash or lesion on your skin or sores, and you suspect you might possibly have monkeypox, you can check out CDC's website. They have pictures to help you to compare if you have the virus or not. Next question: how is monkeypox transmitted? Monkeypox is not like COVID-19. It is very different. It doesn't easily spread. Even if you are only a few feet away from an infected person, you will not get infected. You must have very close contact with someone for an extended period of time. The disease can be transmitted through saliva and open lesions in the person's mouth. It is best for healthcare workers to wear a mask when caring for an infected patient. Kimball says it's rare for the disease to be transferred to humans after contact with the virus on surfaces. However, there was one case transmitted from bed sheets. Next question. Is there a monkeypox vaccine? There is currently no cure for monkeypox. However, the smallpox vaccine eases symptoms. Kimball says the DOH is currently working on shipping the vaccine to the islands. Next question. So what do I do if I get symptoms? Contact your healthcare provider and the Department of Health right away if you experience monkeypox symptoms. So the next question, how can monkeypox be prevented? The CDC recommends the following. Avoid contact with materials that have been touching someone or something with monkeypox. Wash your hands regularly. And use personal protective equipment, such as face masks, when around patients. Next question. How many people have been infected with monkeypox? According to the CDC, there are 24 confirmed cases in the U.S. The highest count are in New York and California, with 5 confirmed cases each. Last question. Why are we seeing monkeypox now? The CDC has been tracking monkeypox in the U.S. for almost 20 years. The first confirmed case was in Texas in 2003. A shipment of prairie dogs was brought over from Ghana to Texas. The outbreak was caused by direct contact with infected pet prairie dogs and not with human-to-person contact. At the time, health officials worked together to restrict the number of African rodents into the U.S. Over the years, as they keep tracking this disease, it was soon discovered transmission from person to person. They keep monitoring the situation. Kimball said, with the increase of person-to-person transmission, he is urging residents to be cautious and remain vigilant, given cases on the mainland and the summer travel season. Next part of the news is about gun violence that's been happening. Governor Ige signed into law a new firearms bill. The bill was signed this past Friday. This bill requires physical inspection of certain firearms, including guns without serial numbers, guns brought in from out of the state, and those guns transferred between people. In addition, Governor Ige signed a proclamation declaring June 3rd National Gun Violence Awareness Day. He said, in the wake of the tragic mass shootings in Uvalde, Texas, Tulsa, Oklahoma, and in so many other cities across the United States, and a week after the shooting, injured 4 in Honolulu. It is more important than ever that Hawaii takes action against gun violence. Hawaii has one of the lowest rates of gun violence in America, and this new law is key in helping law enforcement keep our communities safe. The next segment of the news is about Hawaii Hilton Village fireworks show. This show has been a tradition every Friday night in Waikiki. In March 2020, the show stopped and was on hold throughout the pandemic. Now the show returns. Now the waiting is over. The show will be on Friday night starting at 8 and will continue to light the skies for 4 minutes. This show will continue every Friday night from now until September. In the fall, the show will start at 7:45. Jeffrey Yedlin, Hilton Hawaiian Village manager, Waikiki Beach Resort, said, as soon as COVID restrictions began to ease up, people started calling me and asking me, when are the fireworks shows would return? When are they coming back? When? This has been a 30-year tradition, and then it was put on hold. We realize this is a legacy that needs to be brought back. It was never an if, but it was a matter of when. This tradition started back in 1988 when it was $1 million renovation that was taking place called Return to Paradise. They started out having the show weekly, and then over time it became a tradition and has been that way ever since. With it being the first night of the show in a long time, many spectators will be attending, so make sure you go early. The fireworks are free. The parking is on a first-come, first-served basis.